Ladies and gentlemen, welcome. Thank you for joining today's event, How the End of the COVID-19 Public Health Emergency Will Impact Residents of HUD-assisted Housing. Today, if you would like to ask a question, be sure to click on the Q&A panel. There you'll be able to enter your question, and it will be answered in the Q&A session. Also, if you would like to ask a question via Zoom audio, you can press the raise hand icon. All right, so we'll get started, and I'll turn the meeting over to Jason Amaraji. Jason, please go ahead.
Thank you so much. Thanks to everyone for joining us today. And we're going to go ahead and jump right in. We've got a lot of great speakers here. And I think this is a really important topic about the end of the COVID-19 public health emergency. You all may have heard about this in the news, and there's probably been a lot of confusion or maybe just concern about what this means. So we're hoping to help clear that up for you all today with our speakers. And we have some wonderful speakers from the CDC, from the Centers for Medicare and Medicaid Services, and also, of course, from the National Center for Health and Public Housing, who have been our partners on the COVID-19 webinar series and other health initiatives. Just a few housekeeping items to get started. As Michelle said, please use the Q&A to do questions and not the chat. But we would love if in the chat you were to share, who you are, where you're from, and we'll actually do a polling question here in a second to get some more information about who you are. And then at the end, we have a quick evaluation survey, and I'll put the link to that in the chat. So this is just a reminder before you go to please fill that out. That's really important for our partners at NCHPH and just, for us to make sure that we're giving you the best content to meet your needs. So quick agenda for today. We'll do this kickoff, and I'm going to hand it over to our policy advisor from the Secretary's Office, David Gonzalez-Rice, who's joined us today from HUD. Very excited to have him to share a little bit about potential relief for folks who are maybe concerned about what this means for HUD programs. We'll then have the CDC and CMS speak, and we'll go into hopefully at least half the time that we have today here for open Q&A and discussion. So if you have questions, don't feel like you have to wait for that. You can go ahead and ask the questions at any time, and we'll either ask the presenters as they're presenting to respond to those, or we'll save them for the Q&A and discussion afterwards. So without further ado, I'll hand it over to David Gonzalez-Rice, who's been a great advocate for us on health issues and housing issues for the Secretary, to share some thoughts about the impact of on HUD programs.
Thanks so much, Jason. Thank you all for taking some time to join us today. I want to start at the top by thanking you on the Secretary's behalf for the work you all do day in and day out, week to week, supporting families in HUD-assisted housing. It's such critical work, and we really appreciate the dedication and the care that you bring to it. Of course, as you're working with families, tenants in HUD-assisted housing, HUD programs and services are not the only programs and services that they are using or that they need. So particularly appreciative to our guest speakers today to talk a bit about the broader set of considerations that are coming up now as we approach the end of the public health emergency. I'm happy to say that for HUD programs specifically, my office is tracking a very short list of particular provisions that may or may not impact people who are using HUD services. The couple of things that come to mind are not directly relevant to public housing agencies. For example, our ESG, Emergency Solutions Grant recipients have had some additional flexibility to use those funds to develop new shelter spaces where there is a declaration of an emergency. With the emergency coming down, they won't have that flexibility with using ESG CV funds. We're also aware of some mortgage holders still in foreclosure who are HUD customers. So there's a couple of areas that we're tracking closely, but our program offices have been very intentional about kind of winding down different kinds of flexibilities and waivers. And of course, we do have other flexibilities and waivers that are on other timelines or authorizations that are on other timelines. If any of you are administering emergency housing vouchers that were provided under the American Rescue Plan, then you've probably heard about the date past which you could not reissue a voucher once the initial family was no longer using it. So it's important for us to kind of parse out which deadlines are we up against, which milestones are we hitting. So again, we're not tracking a lot at HUD that's at stake with the public health emergency coming down shortly here, but the people you serve are whole people. They are using resources across the community, and we know that there are other services and things that you'll want to be aware of and thinking about. So we appreciate having this forum to talk about some of those and to take your questions. With that, I'll hand it back over to you, Jason, to introduce our next speaker. I'm happy to stay on, and again, just appreciate your care and attention to this and the support you've been providing throughout this difficult period for our country. Thank you.
Thank you so much, David. And I think that is really reassuring news for folks that, by and large, this wind down won't affect most HUD programs, but we do know that it will affect folks potentially in terms of their COVID care and their access to Medicaid and other things like SNAP benefits. So we're going to move along now. And before we get to Richard Corderone from CDC and Perry Briskin from CMS, I do want to introduce Bob Burns from the National Center for Health and Public Housing. Bob, many of you know if you've been on these webinars with us before, is the director over there, and they represent the federally qualified health centers that are in or immediately near public housing. And very happy to have you on today, Bob. So please take it away.
Thanks, Jason. Really appreciate it. And I think there's been a lot of concern and uncertainty regarding the end of the public health emergency. And we're hoping to answer some, but not all of those questions today, because it's a very broad topic. And we're really fortunate to have our friends here from CDC to kind of give us an update on where we are with the COVID pandemic. And then Perry Briskin here for their Center for Medicaid and Medicare and Medicaid Services to kind of give us a quick shot of all the implications regarding reimbursement for various services in the health area. So looking forward to that. I want to go on to a quick polling question and just ask folks if they would just take a second and fill out a polling question, which I think will be put up on the screen. Just let us know what kind of organization you are. We're always curious. We get quite a mixed bag for these sessions: public housing agencies, health centers, nonprofits / community-based organizations, local or state health departments, government agency, primary care association, or other. So please take a minute and fill that out. That would be extremely helpful to us. And while you're doing that, I'll just mention, please, as you're going along in the discussion, don't hesitate to submit questions or save some questions for the Q&A and discussion portion towards the end of the session. So let me just check with our folks at Event Services. How are we doing on the polling? Are we getting some results there?
Yes, we are getting some results in.
All right, very good.
Looks like folks are still working on.
All right, very good. Well, while they're doing that, why don't we just go ahead and I'll just kind of get started, because I know we've got kind of a tight agenda here today, so I don't want to hold us up. And we can come back in a second. And again, I'm with the National Center for Health and Public Housing. We are an organization dedicated to improving health outcomes for residents of public and assisted housing. We do that through a combination of training and technical assistance, research and evaluation, outreach and collaboration, and especially partnership building. We are a grantee of the Health Resources Services Administration of the U.S. Department of Health and Human Services. The opinions and information expressed, not necessarily from the HHS itself, but from the National Center. How are we doing on the results right now? All right. So public housing agencies win, followed closely by health centers, and nonprofits right behind, and then a mix of government agencies, local and state health departments, no primary care associations today, and then we've got a few other. All right, well, thank you very much for filling that out. It's great to understand who's in the audience. Okay, next slide, please. Really closely, I just want to mention Healthy Together is a toolkit for housing and health collaboration. It was developed by the National Center for Health and Public Housing, an update to a tool we had done about 10 years ago, and we did that in conjunction with our colleagues at the National Nurse-Led Care Consortium, and we had some great input from HUD. And I mentioned it here because in all of COVID and with all of everything that is going on with the end of the public health emergency, partnerships and linkages are so critical. And the toolkit is helpful to finding that. And the link to that toolkit is also on the screen. And folks will be able to get copies of the slides to the presentation after the presentation. Next slide, please. Just real quick, there have been various guidances put out, though I think everyone would like a more detailed and more current set of guidances. And one that was put out by HHS that's pretty useful is in the link that's on the screen, the HHS fact sheet, COVID-19 Public Health Emergency Transition Roadmap. And I'm just going to highlight at a very high level some of the items which will not be affected or will generally not be affected. And it varies a little bit as you go along. But COVID-19 vaccinations and certain treatments like Paxlovid, FDA emergency use authorizations for COVID-19, including tests, vaccines, and treatments, Medicaid, major Medicare telehealth flexibilities, and as well as remedies for opioid treatment programs and methadone programs. Next slide, please. And in terms of things that will be affected, there's quite a few. Coverage, and again, to varying degrees. And so if you're really interested in the topic, there's going to be a resources page later on. You can really get into the detail on each of these. And also a number of these I really won't touch on very much because Perry will be covering them relative to Medicare and Medicaid in much more depth. But coverage for COVID-19 testing for Americans will be affected somewhat, and I'm sure Perry will get into that. Reporting for COVID-19 laboratory results and immunizations and data to CDC. Rich will be talking about that a little bit, and those things are all going down. Certain FDA-related guidance documents for the industry that affect clinical practice and supply chains. FDA's ability to detect early shortages because reporting will be down. Public readiness and emergency preparedness act liability protections may be impacted, and the ability of providers to safely dispense controlled substances via telemed. But we'll get into those throughout the presentation. And this document is available, and this will be in the resources page, which we're going to bring up next. Next slide, please. And there was a question, and yes, the slides will be provided to folks who have registered. So yes, these are some resources that I think would be helpful. Food security is a big issue. So there's something in there from the folks at USDA SNAP that I think you'll find quite helpful. The fact sheet, which we just went through, is available on this, and these links are all live. So when you get the slides, you'll be able to just click on them. The Association of Clinicians for the Underserved Policy and Advocacy Update on looming end of the public health emergency, potential effect of Medicaid unwinding on community health centers, produced by the National Association of Community Health Centers. And the COVID-19 public health emergency unwinding, all as part of a blog from NAC, and then also some more information on what the end of the COVID-19 public health emergency means for health centers from NAC and ACU. So anyway, thanks very much. Thanks for attending this session. And at this point, we're very lucky to have with us Richard Quarterone. Richard is the acting communication team lead for the Health Education Communication Branch, Immunization Services Division at CDC. He's done a lot of work with us and tried to explain what's been going on with respect to the disease and various treatment options and vaccine confidence issues. So at this point, I'm happy to turn it over to Richard Quarterone. Richard, take it away.
Thanks. I'm really happy to be here. Every opportunity I have to talk to people who are on the ground at the community level, giving vaccinations, talking to people about their health, and just in general trying to improve health across the population, I'm always excited to do. So please definitely put anything in the Q&A, and look forward to hearing from you. And honestly, I get more from you guys than you get from me, sort of a secret of the trade here. Next slide, please. I'm gonna just go through really quickly what we've got in terms of disease activity, and you can find have links at the bottom of every slide where you can get this information. But basically, everything is in a relative state of decline, and continuing to decline even in those areas that have higher transmission rates. And this is by county. So, you know, when you look at it, there are a lot of counties in the West and Midwest that are pretty big geographically, but pretty small population-wise. So when you look at transmission and when you look at community levels across the board, those levels are pretty low. And just for reference, in the bottom, we have Puerto Rico, Hawaii, District of Columbia in yellow, and Alaska, just for reference as you're trying to figure out what are those at the bottom. But this is all very positive, and it gets to some of the understanding that COVID-19 is sort of moving into something that is more seasonal, and at least based upon the last year or so of what we've seen in terms of flow of activity. So just again, the data are for level setting. I think you guys are probably seeing something similar in your communities, and this should be reflective of that. Next slide. And again, just real quickly, looking at where we have higher COVID-19 booster coverage, and this is for the bivalent booster, and where that higher coverage is, and just the communities, and again, broken out by county. You guys on the ground probably see this, understand it, and this is just for level setting. This is total population, and so not looking at the higher risk groups, immune compromised, older age groups, and in the darker blue on this map, it's 25% and over, which is important when we go to the next slide, please. So this one is looking at boosters for age 65 plus. And one, you see it already looks a little bit darker. We have in that age group a significantly higher number of folks who have gotten their bivalent booster, broken out by county, and I think you can look pretty consistently and see that difference. And even when you look at it in terms of level setting, this is a 50% and over in the darkest blue. So comparatively speaking, we know there's been significantly greater uptake of the bivalent booster in the over 65 population, and also in those groups and among those individuals who are at greatest risk, or who perceive that they're at greatest risk. And just as we go through talking about COVID-19, as we talk about it in relationship to other diseases, other vaccines, the perception of risk right now is really is something that is very hard to get across, because the roller coaster that we've been on over the last few years in beginning to understanding risk at different points in time is something that we are all collectively as individuals and as communities really trying to process and understand. And there is still, and will continue to be, evolving science on it, even as we get a little bit more understanding about how variants change and how seasonality, potential seasonality, and potential vaccine advances that hopefully will come out over the next couple of years. So with that, again, level setting with the data. Next slide, please. So this is kind of the big late breaking news that will have an effect on practice and the work you guys are doing vaccinating, how you explain vaccination. So this happened a couple of days ago. FDA released new guidance to the EUA, the Emergency Use Authorization, for the COVID vaccine, basically moving to only a bivalent vaccine. So pretty much stopping the use of the monovalent vaccine, the original vaccine. Again, just to level set as we are thinking about this, this is all part of a process as we move into routine vaccination. When 10, 15 years ago, when we had the H1N1 pandemic and the vaccine for that particular variant of flu, that variant of flu got incorporated into the existing flu vaccine cycle every year. Flu vaccines given seasonally, and this is part of that process. With flu, we had an existing sort of vaccine formulation understanding, very old technology, started in the 60s. So it was already sort of in the system. We could update the vaccine. This is a newer vaccine for a newer disease. So the process is going to look a little bit different, but it's going in very much the same direction as we look at what routine vaccination looks like. And so the changes, next slide, please, from a very practical setting, and I won't go through every single one of these, but basically there are a couple of things that are important. So for everyone 6 years and older, and everyone 6 years and older, so 6+, should get 1 dose of COVID-19 vaccine, and it will be the bivalent version of the vaccine because the monovalent version is not really going to be around anymore. That is the new recommendation. But there are some sort of exceptions to that, but that's the starting point for how we understand it. For those who are, and I'll explain it first with adults and then go to children, because children are a little bit different here as well, for under 6. So anyone 6 years and older, 1 dose. If you haven't gotten vaccinated yet, or even if you've completed your primary series with a monovalent, you should get 1 dose of the bivalent. However, if you are over 65, or or have certain immune compromised health conditions, you can get a second bivalent dose if it's 4 months since your previous, for 65, and 2 months for immune compromised. And this is because, one, as you get older and when you have certain conditions, your immune system, it's harder to get boosted. And so having that additional dose in between, or having that additional dose will really, the science looks like it will help you kind of maintain a level of immunity in your bodies to stay safe. So that's adults, pretty much everyone 6 years and older. Next slide, please. So for children, and we're talking age 6 months through 5 years, it's still getting primed, getting the prime doses, and it's different for Moderna, different for Pfizer, but it's with the bivalent vaccine. So because the monovalent isn't available anymore. And so the getting the bivalent doses, and again, it's either 2 or 3 doses. This is because those folks who are 6 months to 5 years, younger you are, the less immune knowledge your system has. So it's really thinking in terms of and working in terms of, flu vaccine, get 2 doses of flu vaccine if you're under a certain age, so that one's a priming dose to get your immune system really kind of going and knowledgeable about it. And the second one is the protection that really kind of builds those antibodies. And this is for those who are unvaccinated. If you have received, if you're 6 months to 5 years, if you've received 1 dose of any of the vaccines, you can receive should get your second dose of a bivalent booster. And that again, that's this 2-dose regimen with that. Sort of, again, very similar to thinking about how in practice settings you guys do flu vaccination. And again, there's one more sort of exception to this with immune compromise. For those aged 6 months to 4 years, the eligibility sort of depends on, is really going to require a little bit more sort of clinical guidance and understanding to kind of understand and know what is appropriate for that individual. Next slide, please. And I'm going to reiterate this. Everything that we do, again, is built on trust. And I don't want to just think of this in terms of trust in vaccines, but it's really trust overall. It's the vaccines, the people who administer it, and all of the policies, and being open and transparent about the policies, the development. And so we want to make sure that this is as clear as possible, and make sure that people know, and that you guys know who are in the community, having these conversations with people, talking about the vaccination and doing the actual implementation of the vaccination in the clinical setting. So thanks. I do have some more slides in here, and Jason can go through those, but there's a lot of resources related to reaching different populations, and just some other things in there that you guys can access. Yeah, those are the next few slides, and I'm going to throw it back to Bob to introduce the next speaker. Thank you.
Thanks, Richard. Really appreciate the update. I'd like to introduce our next speaker now from the Center for Medicaid and Medicare Management Services, Perry Briskin. Perry's a senior advisor at the Center for Medicaid and CHIP Services. And prior to Medicaid, Perry worked in the Office of the Secretary of the Department of Health and Human Services. And prior to her federal service, Perry worked in expanding health coverage and access globally with the organization Population Services International. Perry, we look forward to hearing all you have to say about this big change. So go ahead.
Thank you so much, Bob, and really happy to be here with you all and to explain what's going on with Medicaid and how we can support you and how you can support the people you work with to make sure people that have Medicaid stay covered with health insurance. So I will start on this slide, but we'll just say at the top that there is a lot of content on these slides, so we'll be sending them around afterwards. So don't feel like you need to read every word, and please feel free to ask questions. So what is going on with Medicaid? So at the start of the pandemic in March 2020, Congress passed legislation that gave extra Medicaid funding to states in exchange for keeping people enrolled. So typically with Medicaid, people are reevaluated for their Medicaid coverage once a year to see if they're still eligible. And what we did under the pandemic, with the importance of keeping people covered in a public health emergency, is said, we'll give you extra money, just don't reassess people. And so people just stayed enrolled, had continuous coverage. similar to what people have on Medicare. They didn't have to, show any new paperwork or anything. So that's been going on for the last 3 years. As a result, the number of people enrolled in Medicaid and CHIP, the Children's Health Insurance Program, really ballooned to over 91 million people. So we are currently, Medicaid and CHIP are currently the largest health coverage program in the United States. Normally we would not be that high. Normally we would be, closer to 70 million. So we've really seen an increase over what is typically normal for Medicaid. And that's because people haven't been reassessed and kicked off the rolls essentially for making more income than they otherwise would be eligible for Medicaid and CHIP. Next slide. Next slide, please. Okay, great. And so what the budget bill did, the Consolidated Appropriations Act did at the end of last year, is they ended this continuous enrollment condition. And so they said, we have to return to normal operations. The public health emergency will likely come to an end soon. So we need to start normal operations, which means putting all of Medicaid and CHIP, people who are enrolled in those programs, through redeterminations and renewals. So to basically go through all the rules and evaluate, are you still eligible for Medicaid? You should keep your Medicaid. Some folks will have too much income for Medicaid and CHIP, and they've just been on health coverage for the last couple of years. So what the budget bill did last year is they set an end date for this continuous enrollment condition, which was April 1st. So a few weeks ago on April 1st, states were allowed to start terminating people on Medicaid if they found that they were no longer eligible. Now, where there's concern is that there's a lot of, as probably many of you know, what we call administrative churn in Medicaid. So people who are eligible sometimes get kicked off of Medicaid because they didn't see the paperwork, they didn't fill out the paperwork in time, they didn't fill out the paperwork properly, something got lost in the mail. So what we are estimating is that we think about 15 million people will lose their current Medicaid and CHIP coverage. Half of those 15 million people we think are no longer eligible for Medicaid. They make too much for the Medicaid and CHIP income limits, and they should move over to marketplace coverage where they can get marketplace plan coverage for close to zero premiums a month. Thanks to the American Rescue Plan, but half of those 15 million we think will be kicked off for procedural reasons. We think that about 7.5 million people are at risk of losing Medicaid coverage, not because they're no longer eligible, but because maybe they missed something in the mail or they didn't return a form. And those are the people who are most vulnerable. Those are the people we care the most about. We know those people will disproportionately impact communities of color. We also know that kids are at higher risk of losing coverage. So that is where our concern is, and that's why we're talking with you all today. Next slide. So not all, as with the Medicaid program, it operates state to state, and every state is different. So not all states are on the same timeline. So we created a few visuals for our partners to indicate when states are starting their renewals. So even though they had the option to start renewals and start looking at folks as early as February, a lot of states are not starting until this month, April, to start to evaluate. And once they start evaluating, it takes 60 days on average to conduct what we call a redetermination. So depending on what state you're in, every single state has a different timeline. Every single state has an unwinding plan that they've developed that you can ask your state for. But it's just helpful to know, as you're helping people, to know what sort of timeline your state is on. Next slide, please. And this slide is when you can anticipate the first terminations. So as I said, once you start a redetermination, it usually takes the state 30 to 60 days to determine whether someone is still eligible or not. And for those that are not eligible, or even for those folks who, even after many attempts of contacting them, have not responded, they would terminate their coverage. And so again, it's good to know, depending on what state you're operating in, when you can expect to see people to start to lose coverage and to keep an eye out for that. I will say, once someone has lost coverage, there are options for what to do, because if they're still eligible, they have the right to appeal and to make sure that their coverage is reinstated. Next slide. So just to call out that states have been working with us very closely. We've been working with our state partners to develop unwinding plans, to obtain contact information from people, to make sure that we have the latest address, email address if available. There's been millions of dollars at the federal level, but also the state level, to do additional outreach. So you'll be even seeing ads from a Walgreens or a CVS to be like, hey, if you have Medicaid, make sure your contact information is updated and keep a lookout for paperwork in the mail. And if you receive paperwork, read it. So I think you'll start to see, hopefully on radio, TV, social media, billboards, alerts saying, update your Medicaid contact information, and be aware that these renewals are coming this year. There are a bunch of challenges to overcome. What we've heard from states, there are just a lot of renewals for states to complete. So there are more renewals than they've ever had before, because they've just been building up over the last 3 years. There are significant workforce challenges across everything, we know across all state government, we know across all healthcare providers, FQHCs, everyone is experiencing a staffing shortage. And so this Medicaid and CHIP renewal process is no different. And I think obvious challenge is outdated mailing addresses. So if a person has not updated their mailing address, the latest mailing address a state Medicaid agency may have is from March 2020. Likely people have moved since March 2020. And it's hard if a lot of Medicaid is still on paper and dependent on mailing people physical renewal forms to fill out. And if they don't have an updated mailing address, then it will be hard to reach folks, and they'll be at risk of having their coverage terminated. Next slide. So we have a number of resources for states and for partners on our website. So medicaid.gov/unwinding. We have communications toolkits. We have slide decks. We have formal guidance. So we have sort of a one-stop shop for you to go. And I would definitely recommend the communications toolkit, which has just posters and social media and different tools that you can use to get the word out about Medicaid and unwinding. Next slide, please. So this is just highlighting what is in the communications toolkit. It also comes in many other languages, including Chinese, Hindi, Korean, Tagalog, and Vietnamese, in addition to English and Spanish. And so it just has, plug and play. You can customize this for your state or your organization. Because we know, for instance, in California, Medicaid is not Medicaid, it's Medi-Cal. So we want to make sure that people are able to customize their communications for what fits for the communities they're reaching and their state. Next slide, please. This is just more ideas for what you can use from our toolkit. I just like to particularly call out the flyer in the bottom right, just for people who have lost coverage, how they can reapply for Medicaid coverage, how they can be pointed to the marketplace. I think a lot of people don't even know they've lost Medicaid coverage until they end up at the doctor's office and their card is swiped or their Medicaid number is looked up and it says they no longer have coverage. And so it's just, if we can be helpful for folks to, as soon as they realize they have Medicaid coverage, help them connect to either Medicaid or a new source of coverage, that will be most important, to just mitigate any coverage losses. Next slide, please. We also just have on our website, so people, if one of the actions we're saying is, ahead of getting your renewal in the mail, proactively now reach out to your state Medicaid agency and update your contact information. If you have a new address, a new phone number, people are doing, state Medicaid agencies and healthcare plans are doing a lot of text messaging. So we have on our website a map where you can go to our website and find the contact information for your state where people would go to update their contact information. Next slide. So here are the calls to action and the key messages for you all to help us share is number one, update your contact information. So make sure that your Medicaid program knows your current mailing address, phone number, email if you have it, and any other contact information. And you can go to our website to find how to reach your state. Number two, we ask that people check their mail. So you will get a piece of mail from the Medicaid or CHIP agency, and this letter will let you know what you need to do. Do you need to come in? Do you need to send more information? Do you still qualify? So please don't ignore the mail. We know, these government letters aren't the most friendly, but we just ask that people check their mail and open their mail. And if you get a renewal form in the mail, to fill it out and return it. One thing we have heard is the still residual impact of the public charge restrictions under the last administration and that chilling effect. And so we just want to make sure people are opening up their mail, not that this doesn't have an impact on their public charge, and that we just want to help people navigate this as much as possible because it can be overwhelming and also happening at the same time as reductions in SNAP eligibility and as the whole public health emergency adds a lot of changes. Next slide, please. Speaking of other changes, so there is Medicaid and continuous enrollment, everything we've been talking about, but there are other aspects of the Medicaid program that is going to be impacted when the public health emergency ends as expected on May 11th. So this was just a few other bullets. I think what's most important here is that the coverage for COVID-19 vaccines, testing, and treatment at no cost is going to be available until September 2024. And so that is what, that is just, nothing is really ending on May 11th, except there is some coverage for uninsured individuals, and that is ending on May 11th. But for most people, they'll be able to continue to get vaccines, testing, and treatment at no cost. Telehealth in Medicaid is not at all tied to the PHE, and that continues. So we just want to make sure we flag that for people. And next slide. And that is it for my presentation. Thank you all so much for listening, and happy to answer questions here, or please email me in the future.
Well, Perry, thanks for that. And folks, please get your questions into the chat. But Perry, just to go over quickly what you're saying. So, I mean, you said about 15 million people are going to be affected, and about 7.5 of them are really are still eligible, but they may have an administrative churn or a paperwork processing issue of some kind, and so on. I know that you've been working with the states and different health organizations to get them ready for this. I guess when you were talking, you mentioned that a redetermination, for example, takes 60 days. So are folks who are amongst that 7.5 million, are they going to have to go through a redetermination, or is there some expedited process where they don't get caught up in that and they don't need to take 60 days to go through the process?
So we think that as a result of all of the redeterminations, 7.5 million people nationally are going to get terminated because during that 60-day redetermination process, either they didn't return paperwork, the paperwork never got to them because they moved. So that 60 days applies to most people. What states are doing is, states have different ways of expediting and streamlining the renewal process. For instance, using data they already have in the system, whether it's from other state or federal agencies to determine income. So it's, there are states that are increasingly using automatic existing data sets rather than having to rely on a person returning an individual piece of mail for their own case. So I think we're optimistic that the more states do that, the easier it will be to ensure that people who are eligible stay covered. But that 7.5 million is what we expect nationwide over the course of the next year. So it's hard to know ahead of time who those folks are going to be. Just to talk about children for 1 minute, the Children's Health Insurance Program has higher income limits than Medicaid. So we think that if a child is no longer eligible for Medicaid, there's a good chance they are eligible for CHIP. Mm-hmm. And even in a household where maybe the parents lose Medicaid and have to go to the marketplace, the children can still go to the Child Health Insurance Program, which is often a more robust set of coverage for kids than a marketplace plan. So we just want to definitely call out, we want kids to stay covered and for people to understand that there are often more options for kids than there are for adults, and people should be aware of that.
I'm just wondering, what you're hearing. I mean, I think you on your slide 29, you had put up the effective date of the first anticipated terminations by month. And so right now we're in April. So you're looking at Arizona, Arkansas, Idaho, New Hampshire, and South Dakota. And, just based on the timeline you're talking for processing the redeterminations, those folks, if they're not organized, sounds like they could be in trouble. And I'm just wondering, I'm hoping, the next group is, Connecticut, Florida, Guam, Indiana, Iowa, Kansas, Nebraska, New Mexico, Northern Marianas, Ohio, Oklahoma, Pennsylvania. I'm just wondering if you have any sense of whether or not the states in those groups are any more or less ready, and if they've been able to get people, to get into that, enrollment process. Yeah.
So I will say first that what the Budget Act did at the end of last year, they also put some requirements on states. States are required to start sending us data of how many people they're redetermining per month, who's getting kicked off, how many people are getting kicked off for eligibility reasons, for administrative reasons. That data is going to take a little while to come in. And it may be we understand it may be too late, but we're hopeful that data will make it more transparent of how states are doing and what the process is. So data is starting to trickle in, and we're starting to monitor that. We also have regular stakeholder calls where stakeholders in various states are bringing information to us saying, oh, we're seeing this in, whichever state versus that state, and that's going to be very helpful. And we are just closely monitoring. We have, had a really unprecedented level of partnership with CMS and states in preparing for this transition, which we see as big or bigger of people moving coverage since the start of the Affordable Care Act a decade ago. So we have some internal sense of that, and we're keeping a close eye on it, but we hope to, in the next couple months, to make some of that information make some of the information public. But we definitely encourage people to reach out to their own state Medicaid agencies, because state Medicaid agencies, let's say you have 1 million people in Medicaid in your state, the state has made a decision. It's up to the state of who they want to redetermine first. Do they want to leave the children to the very end? Do they want to leave people with disabilities to the very end? Do they want to evaluate the people that their existing data systems has indicated that they may have income that's higher than Medicaid? So I think it's not like it's a grab bag of who they're evaluating first. So I think it's also good to talk to your state to understand, well, what approach are you taking to redeterminations? Who are you redetermining in the spring, in the summer? You know, when are you redetermining kids? When are you redetermining, you know, certain individuals? So that's also something worth looking at.
In a second, I'm just going to ask Jason to jump in, because I know he's checking the chat for any questions. But I'm just wondering, you know, about the level of coordination, say, between CMS and USDA and SNAP, because obviously, you know, the COVID supports under the public health emergency and before have been decreasing and are diminishing and are impacted, you know, as of May 11th and so on. So I'm just wondering if there's any consideration, you know, for those folks, or any special efforts that are being made around supplemental nutrition.
So I'll just say, I know that Medicaid and SNAP at the federal level is we talk a lot, and we're constantly trying to find ways to streamline that enrollment and that data sharing. It's not easy, and I think the statute, what Congress has allowed both programs to do, makes it harder. You know, for instance, you know, SNAP's still requiring in-person interviews, where Medicaid does not, and that's just something that there are some things we can't get around, but we are trying to work as closely as possible with our SNAP partners to make that data sharing and make that, okay, if you qualify for Medicaid, then you're automatically enrolled in SNAP, and making sure that sort of line is open. So we are working on it, but we do understand how challenging that is.
Well, that would be a major improvement. Hey, Jason, I'm just wondering what you're seeing in the chat.
Yeah, so a couple things. One is, there's a question about, you know, for folks, so it sounds like they're going to get information requesting the recertifications. Is there going to be information for folks who may not qualify to stay on about how to get on, for example, using the exchanges or, you know, alternative insurance?
Yeah, so in our toolkit that I mentioned, and in the information that our partners are putting out, we do talk about marketplace coverage and the subsidies that are there. So people, you know, sometimes people think marketplace, like, oh, that means I have to pay a large, you know, monthly premium. And actually, thanks to the American Rescue Plan, a lot of people can get health plans at $0 premiums. So can essentially get free healthcare coverage through the marketplace. I think I'll also note there's a special enrollment period for enrollment in the marketplace, so people they don't have to wait until the fall to enroll. They can enroll right away due to unwinding. And then we also know that our partners at the marketplace at healthcare.gov are investing a lot in outreach and navigators, and all healthcare navigators are equipped to understand what's going on with this process with Medicaid and help to support people to move people over. So we are including it in all of our outreach, and we're encouraging partners to do so too. So yes, people should be well-versed when they're supporting people to understand how to reapply for Medicaid, but also how to transition to the marketplace.
And Perry, I'm just wondering, you know, health centers and housing agencies have done a lot of work the last few years using community health workers. And I'm just wondering, and at the same time, HHS, for example, has allocated about $300 million for training of community health workers back in November, December or so. And I'm just curious whether or not if there's any coordination between CMS and any of those training programs, because it seems like they could be a help in getting people to the right place to help them, especially during this kind of crucial re-enrollment period.
Possibly. So we have been working very closely with HRSA which I know, but I don't know if Bob, if that's the program, but HRSA is a close partner of ours and has been putting out information to its grantees, its FQHCs on unwinding. So if it is a HRSA program, then absolutely yes. We have been trying to get the word out as much as possible. So I would say for this group, if there are organizations or area of the healthcare or housing system that you feel like need this information and a presentation would be helpful or a phone call would be helpful, we are happy to do that, and just trying to, just spread the word as much as possible and clarify it, because this is not, we do not make, things easy in this country when it comes to the safety net. And so we're here to support people as much as possible.
So let me just also say we had a question that came into the chat around the updated immunization schedules, and we are actually planning an upcoming webinar on that. Haven't quite nailed down the date for that, but maybe coming your way in June, so stay tuned for that. I'll also say, I know we're getting close to close here, so I want to give all of the panelists just a last thought here before we close out. We're also thinking about how to pivot our programming. So I know everything has been COVID focused, and we know that there is a need for greater health programming beyond just COVID. So next month we have a mental health webinar that we will be putting out in partnership with SAMHSA, and more information about that will be coming out soon. And we plan on more sort of health related content that goes beyond just COVID. But in the meantime, I want to just see if our speakers have any last thoughts here. I know there's a lot more we didn't get to cover today, particularly around things like the SNAP benefits and other things that, could be affected from other agencies, but I hope this information was helpful for folks. Maybe we could start with Perry, and then Richard, and then David, and then Bob, and we'll close out.
I just want to say thank you again for having me, and please send me an email or reach out to Bob if you have any questions, and just happy to be in touch.
Great, thanks, Richard.
I just want to say thanks for letting me share. My contact information is here. It's on the slide, so please reach out to me if you have any questions. I'm excited about the upcoming discussion about vaccination schedules, all of those processes, as well as the information related to mental health. I think we've all collectively gone through trauma of some kind, whether it be at a community level, individual level, over the last 3 years, and kind of keeping that at the center of the work that we do, the conversations that we have, and the opportunity to make connections and build trust across the board is really important, and keeping mental health at the center of that is critical. So thanks, really excited, and thanks for letting me join.
Of course. And Perry, just to throw it back to you for a second, quick question, and then we'll move on. Can folks who lose their Medicaid coverage enroll in a marketplace plan now, or do they have to wait until the open enrollment period in the fall?
That's a very good question, and we've gotten it from others, and I need to follow up with that. I'll need to follow up, but very good question. Wonderful.
Okay. Actually, Bob, do you want to give your sort of key takeaway, and then we'll go to David?
Okay, sure. Well, obviously this is a huge issue, and the numbers kind of speak for themselves. I mean, you've got 15 million folks who are impacted here, and 7.5 million who may lose coverage, who are entitled to the coverage. And so I think anything we can do kind of collaboratively and individually. I know health centers and housing agencies, have teams who kind of work on enrollment and benefits issues of residents and patients respectively. And it just, obviously there's just a need for an intense effort, this go around. And so, I wish everybody, well in the effort. And I think, some additional training to the CHWs in this vein, I think would be really beneficial, because I think they could really reach a lot of people and maybe make sure that they don't lose it, or if they do lose it, at least get them to the right folks so they can submit that paperwork properly, and so on and so forth. But thanks very much. And I do want to just mention, I did just send out a reminder on the evaluation. So if you could just cut and paste the link there, and that will just take you to a quick SurveyMonkey evaluation, and it will take you no more than a couple of minutes. So it would really help. So thank you very much. And thanks for the session. Jason, go ahead.
Yep. And if we still have, let's see, we might have lost David actually. So I'll just go ahead and close out and say, we really appreciate you all, helping folks on the ground deal with some of these big changes. I know a lot of COVID involved a lot of anxiety for folks, but also an increase in resources. And so now as we sort of enter a state where things in some sense are returning or to a new normal, we know that as those things are removed and those programs are wound down, that can create its own anxiety. And so we'll continue to put out information and to try and help you all with that transition. And just thank you for all the work that you're doing on the ground. And we look forward to having you join us next month for that mental health webinar. I do think it is going to be very valuable for folks. And then again in June, once we pull the information together for you all on the new routine vaccination schedules. Thanks so much. Stay safe, and we'll see you next time.
That concludes our conference. Thank you for using Event Services. You may now disconnect.